The Return to Practice programme is there for nurses who have qualified and worked for a period of time, and then they've made a decision to leave the profession, sometimes to have family, sometimes for a different job, and want to come back. They've lapsed on the register, so the Nursing and Midwifery Council require that they complete a Return to Practice programme in order to work again.
The programme really runs with a collaboration both between the trust who's providing the placement and obviously the university who's providing the academic side of the programme.
The course takes approximately 3 months. There is some flexibility, but for most it's 3 months. The students come in to the university right at the beginning and have 2 weeks with us. We look at how the NHS has changed, some of the policies and procedures, a whole range of things really, with quite a lot of breadth. We also try and look at support each student individually because they all come with a very different background. What we try to do at the very beginning is to go around the group and ask them all to say out loud how many years they've been out of practice. And although that sounds daunting, it's actually really reassuring because they realise they're all in the same boat.
From a clinical perspective, they need a minimum of 75 hours in practice. The majority of candidates need more hours than that, and it can be between 100 and 200 hours for them really to gain their confidence, depending on how long they've been out of practice.
They're very anxious to start with, and so what Wendy and I have worked out, particularly over the last year, is making sure that the very beginnings of the programme, both in practice and at university, are as supported as possible.
I think they've forgotten what to do. They think that they've been out for so long that everything's really changed, and the fundamentals of nursing are still there, and they haven't forgotten. With the support and the encouragement and knowing that we want them to come back, with it, they're key to the workforce. They find their feet because they actually think, yeah, I can do this.
We've had a completion day recently, and they're so much more confident. They look happy. Some of them have got jobs coming along. Some of them are, just very pleased just to be back nursing again.